Let me welcome everyone to Wednesday morning, as somebody just said, Regis Philbin's show, where we are going to talk about COVID in Daviess County. This morning, I'm very pleased to have Matthew Constant with the Owensboro Public Schools, Matt Robbins with the Daviess County Public Schools, and David Kessler with the Owensboro Catholic School System here. So we have the three major school systems in our community. First of all, let me tell you, I always start with the mask on because I want to reinforce to people how important it is to wear your mask. Wearing a mask is my way of saying I respect you, your family, and your health. You wearing a mask is the same. It's a reciprocal statement that you respect my health, my family's health, because when both of us wear the mask, that's when the masks are at their most efficient. Certainly social distancing is extremely important. Wearing masks and socially distancing is one of the best things that we can do. Remember what our mamas told us when we were little: wash your hands. I mean, washing or sanitizing our hands and sanitizing surfaces and all those kinds of things are some of the best advice that we were given. So mama does know best. And then staying away from large crowds, the biggest super spreaders that we have going on in our community right now. And this is not me talking. This is Clay Horton and his contact tracers at the health department. Are weddings, funerals, and parties. Weddings, funerals, and parties, where you're with a large group of people. You have one or two people who forget, they take the mask off, they're hugging, they're kissing, and it spreads the disease. The governor this morning had a broadcast to all the judge executives and mayors in our community or in our Commonwealth, and he showed the plateaus. When we started back in March, we kind of plateaued. It was a very shallow move. We plateaued at around 500 cases. The next surge was in the summer, and it was a steeper curve, and we plateaued at 2,000 cases, 3,000 cases. This new plateau, this new surge is exponential. It's just like this. And we are up and now adjusted for population in that 10 to 12,000 cases. Once you get that way in that kind of a curve, it's almost impossible to stop. So today in the Grad region, I wanted to let you folks know that we had 152 new cases. 54 of those were in Daviess County. We had one more death today, a Daviess County resident, another death today, a Hancock County resident. That follows yesterday, which was the worst day that we have had so far during this COVID event. So I ask everybody just to take a second to remember those who have lost their loved ones. All right, I brought these school superintendents in today because probably next to the director of our health department, or maybe even worse than the director of our health department, I see them getting bashed a lot on Facebook. And so I wanted to give them an opportunity to tell us in this community what they're doing, why they're doing it, and how we can help. How can we as a community help them? So Dr. Constant, would you, and I'm not going to call you Dr. Constant, it's Matthew and okay. Matt and David. So, and you call me Al, please. So Matthew, tell me what's going on with Owensboro Public Schools.
Well, right now, as most people know, as of last Friday, and kind of an unexpected last Friday, we had to go all virtual. And that was due to the community spread. We had decided that once we began seeing it more prevalently in our schools, which we have, we would make that call. So we had intended to do it as of last Monday, But a sector of our support staff, it came up positive, and that affected our core services, so getting kids to and from school and feeding kids and educating kids are our core services. And when those seemed compromised, and they did, we just went all virtual. So we call that until December 4th. We will come out on December 3rd and say what's going to happen for the rest of December.
Okay, Matthew, let me just say, so contrary to what was circulating in Owensboro, and if you recall, I kind of texted you, didn't I?
Yep.
They're dropping like flies at the Owensboro Middle School. Teachers, I have it on good authority, teachers and students are ridden with COVID. That wasn't true.
That is not true. In fact, if you do a positivity rate within the building, which, we need to do the community number, but we'd like to look within our buildings, it's still very low. What the issue is, especially at middle and high schools, is the quarantine factor.
Right.
And, once you get so many in quarantine, it starts to look like it's rampant, but we're just trying to err on the side of safety there.
When you don't have cooks, when you don't have bus drivers, when you don't have maintenance people because they've been quarantined, when you don't have those non-certified folks who really make the schools run behind the scenes,
absolutely,
it's awfully difficult to have any normal semblance of school. David, tell us about the Catholic school systems.
Well, in our case, we're just a little bit different, and I've talked to both Matts about this. If one good thing that's come out of COVID has been our relationship and working together this whole summer has been tremendous in this county, which is thank you to them for all their help. This is the only time where small actually helps us a little bit, for the fact that, we have the ability to do a little bit more on sheer number of being able to spread our kids out and follow those protocols that we've set forth. And we've been truly blessed that our kids, our teachers, everybody has just completely bought into, we've got to do this. We've got to wear a mask. We've got to follow all these protocols. And we've seen really no transmission from that. We've had our share of quarantines just like everybody else. But luckily we've been able to work through those quarantines. We've even brought in a little extra help to help deal with those quarantines to make sure kids are still getting taken care of when they're out. We get them back, and they're currently all back in school. Now we're still waiting on what will happen tomorrow, what will happen in the next week. But we're continuing to push on to the best of our ability, knowing that we're just going to continue those above and beyond procedures that we have already been working on so hard for the last 6 months, but continuing knowing that we still got to step our game up, because this is the critical part of what happens in the next month, not only in our school, but in our community as well. So it's been a team effort, and I feel truly blessed how well everyone has jumped in to do that. And we're hoping that we can continue to do that. But it's going to be a community issue that we're just going to have to keep working and working and working, and hopefully don't have to get into a situation where we do have school transmissions. But at this point in time, we're just not seeing that.
Okay, thanks, David. Matt Robbins, give you a chance to talk about it a little bit.
Thank you, Judge. And just to really kind of dovetail on what both of these two guys have well stated here, one of the hallmarks of our scheduling when we started, first of all, we're outside of Warren County. We're the largest school district in Western Kentucky. And so that means we have a lot of people, a lot of students, certainly. And so our main hallmark was about consistency and stability. And how could we get on a schedule and try to stay on that schedule without, having this, constant interruption. We found out that we were able to do that with the AB schedule, again, with our size considered there. And we've been on that K through 8 since middle of September. We started out with a stoplight model that sort of indicated what schedule we would go to before we had any experience. And I've received a lot of questions about why the county, when we went initially on red the first time, and it was only for about a 48-hour span of time. And then we most recently, been on red, and doesn't look like we're going to get off of red anytime soon. And the way I've answered that question is based on experience. Experience always is the best teacher, but under a pandemic, we had not had any experience on these different schedules. But our experience told us on a more moderated level of red that we could continue forward. Once the county actually started seeing cases, I would say mid-30s. Of course, we kind of flew up to 40 pretty quickly. But once we started seeing that accelerated spread in the county, we started to see the effect numerically on our staff, such as last week, just so that we give a perspective. We had 97 staff members either positive or quarantined, most of them quarantined. And then we had 532 students that were out. And it's kind of stayed fairly close to those numbers. And then you continue to look at the community spread of this virus. And I will say, I'm not a doom and gloom person. I like to look at the glass half full, but I'm very concerned, Judge, about where we are as a county going into the holiday season with having so much spread of the virus, knowing that's onboarding here in the next few days. So your message couldn't be more paramount that all of us need to hear, is that mask wearing, socially distance, even among our family. And that's going to be a little hard, but we've got to remember those things, because that's the instances that we're experiencing, both cases coming to us. That's where it's happening largely, is within small social gatherings of our people.
Matt, thanks. And you're so right. Besides funerals and weddings and parties, Clay Horton with the health department says that they're starting to see more family groups. It's spreading within the family group. One of the young people brings it home, and mom gets it, and then dad gets it, and you got 3 and 4 folks within that family group. Then it gets transmitted to grandmother and grandfather and maybe a uncle, and that's the way those things go. The school system is not the only system that is having issues with staff. We have gone from about 5 people in intensive care in Daviess County back in the summer. Now we're up to 20, 21, 22 people in intensive care. When you see those numbers in intensive care, that's an indicator of future deaths in the community. Number one, we are still have a good number of bed capacity. Problem will be, at what point do we not have nurses and doctors to treat those people? Just like you not having staff to teach the kids and do all the things that need to be done to run a school. So let's talk about the red zone. I know there was a lot of conversation back when we went into the red zone, popped out for a while, and then went back in. Wasn't one of the governor's recommendations that if a county went into a red zone that we go into virtual? And I know, Matt, you talked about it a little bit from the experience, but your decision to continue face-to-face on that AB schedule as opposed to going back to virtual sooner, was there a reason? Was it just your gut feeling, just the experience that you had gotten over the last few months of running the AB schedule?
I would say that certainly our experience of how we were able to operate, coupled with the fact that it's pretty well proven, even if you read internationally, some articles that looks at community spread as opposed to schools being open. And when you look at that, typically what you're finding is that, and we've said this, schools do not appear to be adding to community transmission. And we can really see that on the hybrid schedule, where we have roughly 50% of our school building loaded. We're able to distance. We're doing all the things inside, and I know that all 3 systems that are represented here are doing it very well. We're doing the things within the school that's required to limit or eliminate the transmission. So I would say the coupling of those two items, both the AB schedule, our experience, plus the fact that we're not contributing to community spread, gave us the satisfaction. It was only when our numbers internally from providing the service that we provide became detrimental.
From your own experience
Yeah.
internally.
And
That's
Matthew, do you have anything to add to that?
I do actually. I would agree with everything that Matt said. We have turned ourselves into a more of a data-driven operation because of the experience that we've had. We have been able to see down to the positive case level in each building, if we are contributing to the community spread or not within our school walls. So if you walk in a school building right now, you will be in one of the safest environments in the county, maybe just next to the hospital, I would say. We have created a very, very safe environment for anybody that walks in. So that would be number one. But number two, as my colleagues have been talking about this morning, we have maybe one case, we're researching it right now, where it's been transmitted in the school. All of our issues come from outside. And just as Clay said in the paper today, we are seeing what happened as a result of Halloween right now. And so if we push this forward to a Thanksgiving gathering and then a Christmas gathering and then a New Year's gathering, we are all very concerned about what December, January, and February are going to look like.
Okay. David, since you guys have been face-to-face during your school year, do you have anything to add? But I'm sure you're doing the same things and feel the same way that these guys, that the Catholic schools, the buildings are very safe for people to be in.
Yeah, we have really pushed that from the very start, that we felt like our kids were the safest when they were at school, and we had set our standards that we were going to continue to do that and have our kids in person unless we had an issue where a transmission became a problem, and that fortunately has not happened. But even when the county became red, I think that was just like, it's a light that says, now you got to step up your game even more. It's where we really ought to pay attention to what we're doing. Even though everybody was doing everything that they obviously should have, it was just another indicator that we really have to step our game up for what we're doing and continue to evaluate where we're at with that. Okay. Luckily, we have not seen that transmission, so that's why we're continuing to do the very best we can to keep it that way. But to go along with what Mr. Constant just said, that this is concerning as to what could transpire after the holiday season with what we might be facing in this county.
Well, let me say this. I hope that parents who have children in all three school systems, if there's one thing they take away from this is the realization that all three school systems are doing everything they can to keep it out of the schools and that their kids are safe. And for that, I want to thank you. I do want to go back, Matthew, and you alluded to this in a conversation with Clay. And as you can imagine, I have conversations with him either by Facebook or email or message every day. He's letting us know what's going on. And this morning I gave him a call talking about what may or may not happen this evening with the governor when he comes out with some, not recommendations this time, but some mandates. Clay told me that there has been, to their knowledge, no secondary spread in a school system, meaning student to student, that anytime a student might come down with a case of COVID, that it's always traced back to outside of the school, meaning they went to a party, they did whatever. So that to me is again comforting, or would be comforting if I had a child in school. Halloween, most of those came from Halloween parties, and both the mayor and I and everybody else talked about, there's a way to have a safe Halloween for kids staying in family units, trick or treating, avoiding close contact, wearing masks. Please don't have parties. And as usual, the plea was falling on deaf ears. So talking about spread, how do we square up the going virtual in school systems and continuing to have sports practice, football games, basketball, practicing, getting ready for basketball? How do we square that up? Because those are very close physical contact. I know, and I'm not an expert on what the recommendations were from the state, but I do know that they talked about when you go into a red zone. I think they pretty much left you guys up to follow whatever the Kentucky High School Sports Association guidelines were. So would somebody talk about that?
Well, they're just meeting right now. They may have just concluded it. I feel like what might come out today is that winter sports will be delayed. I don't know if that's official yet or not, but they're highly considering just a delay of all winter sports, which I would be in favor of until hopefully this gets better in the community. But from the beginning, this has been brought up several times with our board, and I would just say a couple things about it. One, all of our teams are in small cohort groups. So they practice together, they play games together. And so in that way, they are in their own small cohort group. But secondly, we've said from the beginning that athletics are a choice that people make. And so school is not really a choice you can make, but athletics is. And so if you feel unsafe in any way, then don't play. Now, I do have I have personal issue with, us being deeply red and playing athletics, and I see why the community would take issue with it as well. We are still hopefully going to play football for a few more weeks, and we have said that, because of the postseason implications of this and the opportunities of our kids, we can do some things with our venues. We can further restrict who comes to our venues. We can double down on the safety practices, but let's try to get these football games in because these kids have worked so hard to get to where they are. So that's what I would say about athletics, but I would invite any of my colleagues to say anything else.
David, so you're not a public school. The Catholic school system is a private school, but I'm assuming you still follow the Kentucky High School Athletic Association's recommendations.
Yes, very much. And that's, I feel like it's a very, very close carryover to the same things we're doing in the school building. And our kudos to our coaches that have taken it seriously, knowing that it just takes one misstep, and you're right, these kids are going to miss out on an opportunity that they could have had. So that is something that we pay very close attention to, and they have taken that very seriously to be able to continue the safety practices, and we've seen it over and over in all of our sports that it only takes one slip up or not following it correctly, and we don't want to do that. We've seen it all over the state, but it will be interesting to see what happens with winter sports when we move indoors. I think that's going to be a concern because we have been able to have different situations for football to spread out, to limit capacities, to do those kind of things. So it's going to be an interesting decision from them. And it's something that we're really going to have to pay close attention to in our own situations too, to determine, if what we're doing needs to be done or not, or make changes to. So,
Matt, tell me about Daviess County Public Schools and sports.
Yeah, well, Dr. Constant covered it quite well.
He didn't slam you because senior high is still on the. I took that as a smack.
Yeah, I mean, this is one of those things where once we get here, he's got a great team there to support his community. We're going to get behind them.
There you go.
So that they 100%. Get his parcel. Absolutely. But to add to this, there's nothing easy with this. I've had people ask me about that and said, you look at Apollo High School or Daviess County High School, my two high schools. Well, on any given day on our hybrid schedule, we would have anywhere from probably 500 to 700 students, on campus. And, now the basketball, we're talking about a team of 15. So numerically, there is a gigantic difference. However, I think where we are as a community right now is in a place we've never been before. And that is, we're at 50 roughly. Maybe a tad bit underneath that number, still on the uptick. So, we really need to get a handle on this virus. So there's that. And the hard part about this is these young men, young women have worked so hard. You only get one shot in life at this, right?
Right.
You don't get mulligans to go back and do it over again. And so that's where your heartstrings go out to these young student athletes. Maybe some of them have post-secondary opportunities to go on and play collegiately, but even there, that could hamper an opportunity for them to get a scholarship. So it's much more complicated than trying to contain this to a sheet of paper. But what I would say is we're all chasing this virus, and it's moving constantly. It's never been in the same place for the last 8 months. And so our strategies have to deal with that, like it or not. I don't like most of it, contrary to what some others might say. We all believe that kids ought to be in school every day. We believe that athletics ought to be going, that we need that. It's not that we want that, we need that to happen. However, to keep everybody healthy, that's paramount. And we've got to make sure we're keeping our eye on that.
Well, let's be honest. Lots of folks want the schools open because they need that babysitting experience. They need the child care that is provided, not necessarily in our high schools, but our grade schools or middle schools. And that going back to virtual is creating a real problem, a huge problem. Yes. For working single parents, mom or dad, or single parents, and even two parent families where both parents are working and are having a hard time finding childcare. That's the need. I think really the need for low cost childcare, affordable housing, and low cost transportation in our community has really been pushed to the forefront by this pandemic. And I absolutely hope that people who call this the new normal don't forget the new normal and those needs that have always been there when we go back to the old normal, if we can. Just a statement. I absolutely understand an 18-year-old not getting to play their senior football game or the opportunity at championship. But remember that some of us older generation, we don't have the years to give up. On the backside, we have no years to give up, and essentially, my wife and I have lost a year out of our lives here at the close in the autumn of our life that we look forward to doing a lot of things, and we're not getting ready to do. It is complicated. It's absolutely complicated, and I see some people though who believe it's just the simple answer is this: lock the community down. Lock it down. And I would say to those people that want us to lock things down, they have the ability already. They can lock themselves down. There's nobody that's asking them to go out into the community, to go shopping, to do those kinds of things. And that's why I think you find even the governor reluctant to take that very last step. So what are some of the things that perhaps the community can do to help our school systems? Is there anything that you can think of right offhand that we're not doing that we could be doing?
Well, I think it just starts with the things we've said is about, if we can control or get a better handle, I don't think we can control it in its entirety, but if we can get a better handle on our community transmission of the virus, which means doing the things that we have at our fingertips, we can do that. We can get it to retreat. Then it allows us to resume, which allows us to have school and provide children. One of the things I also want to mention here that we know is happening, I've cited it several times, is some of the detrimental environments that our kids can find themselves in. and there's statistics that support that. I won't belabor that, but I also know that adults as children alike are struggling with mental health, emotional issues, and I can understand that. I've dealt with it myself, but not maybe to the level of some others. And I just know that that's a big component that, is out there. But if we could do anything as a community, I think I would hope many of us understand that having school is essential for kids. And I think maybe this is the first time we've been in a pandemic since 1918, as what I understand, one of this kind, this magnitude. And I would hope that at least some notes that we're taking as we're going along, if we find ourselves in this spot again, hopefully it's another 100 years and well past my tenure, but we could find some better ways of doing things to get schools held constant.
Matt, I often talk about the flu pandemic, the Spanish flu, or the pandemic of 1918. And I tell people that my dad was born in 1919. He had a sister born in 1918, and she died as a result of the flu pandemic. My dad was raised by foster parents because his mother died in 1922. So he was 3 years old, and this is 4 years after 1918, but they were continuing to have resurgence of that flu. People talk about it's unprecedented. It's not unprecedented. And we know so much more today about the transmission vectors. And even today, as I listen to Dr. Stack on a Zoom meeting, we know how to treat people better. That's why we actually, while our numbers are rising, a percentage of those who die is falling. We know how to treat people. But our concern is flattening that curve so we don't just inundate all the folks that we talked about earlier. Guys, I interrupted. Matt, you or David want to say anything?
I just would echo all of that Matt said. If you rewind back to March, we all were pretty vigilant then because it was new and, emergent. We're tired now. I mean, I'm tired of it. Everybody is tired of it. And when you get tired of things, you get lax with things and you start going to see grandma again and you start maybe going down to Florida again. And, all of those things that really we shouldn't be doing. And it just, kind of kills me to walk in a community place and you got lax mask wearers, either not being enforced, not wearing properly, and those kinds of things, one here, all of a sudden, we're here where we are right now.
Good point. My wife and I and our son, Will, we always took a family trip Sunday before Thanksgiving, come home on Black Friday, because nobody is flying on Black Friday. They're spending all the money. And I looked for every reason to take that trip, but it finally popped in my mind, how in the world can I ask other people to change their habits if I'm not willing to change mine? And Judy and I are going to spend Thanksgiving at home. We're not going to have, my son won't be over for Thanksgiving. But we're doing that because we're hoping to be able to celebrate the Christmas holidays together. So David?
Yeah, I reiterate everything that's been said. I mean, it's as simple as it's this simple. All you have to do is put this on, and I agree that it's frustrating when you go into a gas station and you're the only one in there that has a mask on. Especially since all three of us have been pretty much doing this 24 hours a day since March. I don't think people realize how much it really is weighing on us of trying to figure out ways to keep our kids in school, and then just to see that support not be there. Like, we're not asking you to give money. All we're asking you to do is put a mask on so that we can kind of contain this in our community. And it's free. We'll give you a mask if you need one. But that's what we need. And I agree that it's going to be important for everyone. It's not going to be the Thanksgiving we're used to, and it's not going to be the Christmas that we're used to, but it's going to be important that we do it so that we can move forward. in order to have more of those. So, I just encourage people to please think about that and to make those decisions. I know they're not popular, but it's something that we just really, really need to do as a community in order to work through this.
Well, David, thank you, because I think what I heard you say, and Matthew and Matt, was that the best thing that folks can do to help our school systems is to follow those recommendations by the governor, by the president, by CDC, and mask up, sanitize your hands, avoid large crowds. And if you feel ill or sick, don't go to school, don't go to work, and get yourself tested. One last question. I'd be remiss if I didn't address something I heard the other day, and I told that person that I didn't believe it for a minute. So tell me about this lost year of education. How will that affect your students 20 years from now? Think about it. Will it have an effect?
There's no doubt it will have an effect, but there's also no doubt in our concern about that, our proactivity to try to shore up any gaps we've got going on right now. And we're doing some things right now to anticipate that, bringing in small groups of kids that are the most at risk, just in small groups still. And it is heavy on our minds, and we would be lying if we said we weren't concerned about the after effects of all this. But it's a nationwide, worldwide issue.
Yeah, that's
David?
I mean, I feel the same way. I mean, we're not going to know for a long time, but I feel like the good things that have happened is that there's been a lot of technology that's been created that's going to really allow us to dig deep into where our kids are and be very specific at things that they might have missed or things that they might need help on that we've never had in the past. So I think that will really help us identify where kids are and really specifically target those things moving forward, which will allow them to catch up faster than they ever have. So if there's a silver lining to it, we are learning some things through technology that are going to help us identify what those gaps might be.
Okay, Matt, I'm gonna give you the last word on it.
Oh, man. Wow. Okay. Well, we're already having conversations. We're in the COVID period now, but we know there is a post-COVID period, right? I don't think you can be walking and not understand that all elements, particularly our children, are going to be at a loss at this point in time. But here's what I'll say. Our educators, all these three systems that are present here today, and not just here across this state, they're heroes. They really are. And our teachers, the support staff, our administrators, we're not benign to this fact. We understand it, and we know that we've got a lot of work that will be ahead of us during that period of time. But I'm convinced, just by what I see from the reactions of my own staff, we will measure up to the challenge of meeting the needs of our kids moving forward. That's going to happen. I'm very resolute about that and very confident in that. So yes, these gaps exist. There's no doubt, and it's unavoidable. You don't replace 5 days of instruction with 2 days or no days and trying to do it. That's just inherent with that. But we're going to make up that difference. That's what I would say to those parents, as well as those young people among us right now. Is that'll happen as we move forward.
Well, I like that glass half full, because that was my answer. While you can't measure the emotional effect, the mental effect, I absolutely have no doubt that these kids are still getting one of the finest educations they could get anywhere in our nation, given the circumstances. And I don't worry about them at all, because the kids today, we always talk about the young generation and their lack of qualities. I remember my mom and dad talked about my generation that way. So I think that's always a way of making older generations feel better. That's our go-to excuse, right? But I have tremendous faith in the future of our community and the future of our education system and the kids that come out of it. So on behalf of everyone in Daviess County, I want to say thank you to these three gentlemen for their leadership. I want to say thank you to the teachers, the frontline workers in the classrooms, and those staff who work behind the scenes to make it a go. So with that, folks, I don't see Jordan. If there are any questions or comments, I don't see them. Once again, I want to say, mask up, do it. The mask absolutely protect you. They protect me, and they protect those folks around you. They are effective. I don't care what anybody says. Go to all the CDC studies and you can see it. And I'm saying that not as a judge executive. I'm not saying it not as a mechanical contractor. I'm saying it as someone who has a degree in biology and understands a little bit about what's going on. So wash your hands, avoid large groups. You know, and social distance is very important. In my office, when you come into my office, you put a mask on and you sit about 10 foot away from me. It's not because I'm worried about you or about me. It's because I'm worried about you and what I might have. So with that, gentlemen, thank you for being with us. To the folks who are out there, I invite you back about the same time next Wednesday. We haven't decided yet who we'll have, but I hope to have someone from Washington, D.C., possibly, who can talk to us about the vaccine. So until then, everybody be safe. Thanks, guys.